Namaskaram. I am Dr. Surej, and today I am going to discuss with you Ankylosing Spondylitis and its Ayurvedic management. It is a condition that usually affects the spine. Ankylosing Spondylitis is composed mainly of two words, ankylosis and spondylitis. The word ankylosis means fusion, and spondylitis means the inflammation of the vertebrae or the spine. It is also known as axial spondyloarthropathy. It is a condition which affects the spine and causing it to fuse the bones of the spine, thereby leading to difficulty in the movements, and also in the worsening of this condition can cause a hunched posture of the persons affected by ankylosing spondylitis. Now, what causes ankylosing spondylitis? There is no particular reason or a particular cause that is yet found which leads to the formation of ankylosing spondylitis in the humans. But researchers have connected a presence of protein called as HLA-B27 in patients who are affected by ankylosing spondylitis. HLA-B27 is specifically found in persons with certain genes in the body that leads to a particular bacteria that causes the person's bones, especially of the spines, to get fused over each other, leading to the condition called as ankylosing spondylitis. Unlike the other arthritis, it is usually seen in the younger stages of the person's life. How do we understand ankylosing spondylitis? It starts usually with the pain in the lower back, especially in the sacroiliac joint. The sacroiliac joint is a place where the spine meets the hip. It starts with the pain, and over the period of time, or when it worsens, it causes the fusion of the bones, thereby making it difficult for the persons to bend forward or to stoop forward, and in worsened conditions, it can cause even a hunched posture of the person affected by ankylosing spondylitis. Usually, the persons affected by ankylosing spondylitis, the symptoms vary from person to person. In some, it may cause a low back pain. It may be usually seen as the stiffness of the neck, and in some cases, it may be seen as pain and stiffness of the peripheral limbs, especially the foot and soles of the persons. Therefore, we can divide the ankylosing spondylitis mainly into two, or classify the ankylosing spondylitis basically into two. One is the axial spondyloarthropathy, and the other one is the peripheral spondyloarthropathy. Axial spondyloarthropathy usually affects the spine, whereas the peripheral spondyloarthropathy affects the other limbs and joints. How do we in Ayurveda approach ankylosing spondylitis? Unlike the modern medicine, Ayurveda pays utmost importance to many factors in the formation or the causation of a disease. Considering the ankylosing spondylitis, we can see that it is mainly due to the formation, or it is mainly due to the imbalance of the Vata dosha, and also due to the presence of ama or toxins in the body. Vata, one of the doshas, or one among the three doshas, is primarily responsible for the movement of the body and the joints especially. In case of ankylosing spondylitis, this Vata undergoes an imbalance and it starts affecting the joints, and thereby leads to the condition of stiffness and also pain. Apart from the imbalance of Vata dosha, it is also seen that there is a presence of ama, that is the toxins that are built in the body over the period of time. Another reason for the formation of ama is the imbalance of Agni. Agni is the metabolic fire, or is otherwise the digestive fire in the body. So when there is an imbalance of Agni in the body, it leads to the improper digestion of the food that we take, thereby leading to a different, or thereby leading to the different types of toxins in the body because of the incomplete digestion of the ingested food. Apart from the imbalance of Vata dosha, presence of Ama, and the imbalance of Agni, environmental factors also plays a crucial role in the formation of a disease. In ankylosing spondylitis, a person, when he is exposed to extreme cold or severe cold situation, can trigger the condition because the cold always leads to an increase of the imbalanced Vata dosha in the body. So how do we manage the ankylosing spondylitis in Ayurveda? Unlike any other medications where there is no cure for ankylosing spondylitis, Ayurveda promises a holistic approach in the management of ankylosing spondylitis. Here we indulge the persons in Panchakarma treatment. We give importance to the herbal therapies, that is the internal medications. Also, we give utmost importance to the dietary practices and the lifestyle modifications in the curative aspect of ankylosing spondylitis. The role of Panchakarma. Panchakarma is the fivefold detoxification methods that are applied in Ayurveda. It has Vamana, Virechana, Nasya, Raktamokshana, Kashayavasti, and Snehavasti. Here, Vamana is basically done for conditions where there is more of Kapha in the body. Virechana for the Pitta, Rakta Mokshana again for the Pitta, and Vastis are mainly used for Vata. In a condition of ankylosing spondylitis, we use extensive types of Vastis for the cleansing of the persons. Apart from that, there are certain techniques that are used, such as Svedana and Snehana, depending upon the patient's condition. We use different types of poultices that can help to reduce the inflammation and the stiffness that are caused due to the ankylosing spondylitis. Apart from this, we also give importance to the herbal therapies, where we use different types of herbs that are mainly intended to bring down the inflammation in the body and also to control the immune system, not suppression, but to control or to modulate the immune system, especially since ankylosing spondylitis is said to be an autoimmune condition. Unlike the other medications or other systems of medication, Ayurveda pays importance to the lifestyle modifications and also to the dietary modifications when considering the treatment of a disease. Here, while treating the patient, we ask them to change their lifestyle after a detailed consultation and advise minor exercises or yogic postures after the treatment so that the person can lead a healthy lifestyle even after the treatment. Also, it is important that dietary modifications are met after the treatment so that it can cause the correct balance of the Agni and the proper digestion of whatever food is taken in the body. So Ayurveda is a holistic approach, or Ayurveda takes a holistic approach while taking or while understanding or while treating any particular diseases. Before taking up any diseases or before taking up any treatments, it is always advisable to consult a physician for a proper diagnosis and for a proper treatment. Please visit Ayurbethaniya for more information on ankylosing spondylitis and its management. Thank you.